Hey there, hey, it's Dr. Nicole, board certified family medicine physician, locums physician, and all things wellness physician. Just wanted to come on to give you a couple of tips. It's holiday season, and I know people are traveling after the holidays, me included. I'm sitting here in the airport right now. Actually, I'm just coming back from a locums position. Locums is, think of it like substitute teachers, but for doctors. So when there is a need in a clinic somewhere or in a hospital, in urgent care, sometimes if they don't have enough coverage, they will hire locums doctors to come in and fill in for shifts. And so I am doing some locums positions off and on for the next couple of months, a couple of days here, a couple of days there, just to help out in where there is a need for medical coverage and for doctors. So I'm traveling back actually from a locums position. So this kind of spurred me to do just a live real quick, just to kind of update people on what's been going on. Listen, we are the week in the middle of the beginning of the holiday season, the week after Thanksgiving. People are coming back from spending time with their families on Thanksgiving, and guess what? I worked in an urgent care. That's where I did locums this past weekend, or this past couple of days, and people are coming down with, guess what? COVID, flu, RSV, and mycoplasma pneumonia, which is a walking pneumonia. So it's the week after Thanksgiving. So what does that mean? These folks were all with their families or Friendsgiving, Thanksgiving for Thanksgiving. And so wanted to give you a couple of tips on what you need to do if you are planning on meeting with family or friends, Thanksgiving, Christmas time, holiday time in general. Number one, you do need to make sure that you are doing well before you go and spend time with others. So if you have any type of symptoms, respiratory at all, cough, cold, sneezing, stuffy nose, sinus infection, sore throat, of course any type of shortness of breath or wheezing, but you should, number one, go and get tested. Get tested for COVID, flu, RSV, okay? RSV is respiratory syncytial virus. It's a virus that is also spread by respiratory droplets, and it is very rampant right now. It usually affects babies, but it can also affect adults and elderly people and people with chronic medical conditions as well. So make sure that you go and get tested. You actually can get one swab that can test for flu, COVID, and RSV all together at some urgent cares or ERs. So make sure you go and you get tested before you go and you be around others. That's number one. Number two, if you have any type of symptoms at all, don't go. All right, go virtually, send a dish or whatever you're going to do, but don't go. Keep everybody safe. The numbers that I saw this past week of RSV, flu, and COVID were astronomical. Yesterday in clinic, in the urgent care alone, I believe we saw almost 100 patients. Most of them had respiratory symptoms, all right? Now, let me also say this. You don't have to have respiratory symptoms or any type of symptoms at all to still have COVID. So maybe if you're going to be around people who are immunocompromised or people who are ill or elderly, have chronic medical conditions, you can just go and get a test just to be on the safe side, to make sure that you are not passing COVID as an asymptomatic carrier, all right? So go and get swabbed before you go to those holiday gatherings. All right, number two, get tested after the holiday gatherings or just in general if you have any type of symptoms. Don't just attribute it, oh, it's just a cold, oh, it's just sinuses, oh, it's just the weather change. I know it was 50 degrees last week and this week it's 20 degrees, so it's just the weather. If you have symptoms, go and get tested. Sore throat, ear pain, ear congestion, ear pressure, headaches, nasal congestion, runny nose, nasal drainage, coughing, whether it's a productive cough, meaning mucus is coming up, or a non-productive cough, meaning it's a dry cough. Certainly if any shortness of breath, then you need to go and get tested, all right? Go and get tested. Other things that we need to do, wear a mask. Okay, I'm sitting here in the airport now, of course, so I have a mask on. It's amazing. I had one person who I talked with last week, just in general, and they were saying that they are not going to do any traveling next year because they were kind of angry because their family member got COVID and had a pretty bad case of COVID after traveling. And I said, well, Okay, I can understand that. I can understand your frustration and maybe not wanting to travel in the future, but we all can't just stop traveling. I mean, I guess some people can, but I'm not going to do that. So I asked, well, did the person have a mask on? And of course they didn't. Hey, guess what, guys? COVID is still here. Flu is still here. RSV is still here. All of these viruses and bacteria is still here. So if you're going to be traveling around a lot of people or in tight, close spaces like an airplane, like a cruise ship, wear your mask. And make sure that when you're wearing your mask, you are wearing it correctly. Over your nose, okay, under your chin, all right? So that you are keeping it should be sealed to your face, okay, so that viruses can't get in. Let me also say this. Make sure if you have to cough or sneeze while you're wearing a mask, keep the mask on. I have seen multiple people who do this. I'm going to show you. They'll go, achoo, and then put the mask back on. What? No, that's not the way this is supposed to work. So what a mask is supposed to be for is to protect others from respiratory viruses, and also to protect yourself from the spread of the respiratory droplets that carry these viruses, okay? So if you have to cough or sneeze, keep your mask on. It's okay. Cough or sneeze into your mask. Achoo, okay? Cough into your mask. It's okay. Whatever virus that you possibly could have, or whatever germs you might have, I know you don't want those to be near you, but you were trying to protect everybody else, all right? We don't want it, and especially if you don't want it, wear your mask. Wear it correctly. And please, again, don't pull your mask down if you have to cough or sneeze. All right. Another thing I want to tell you is if you are traveling and you have a long layover, go ahead and get some walking in. It's a great way to stay healthy during this holiday season. I know we're all eating the beans, greens, potatoes, tomatoes, chicken, ram, ham, you name it, all of the things. And so we can actually put on some pounds during the holiday season. So we should be drinking lots of water, okay? Taking your multivitamins, and then getting in some exercise. So what better way to get in some exercise if you're sitting at the airport with a long layover? Walk some laps, okay? Instead of taking the tram, walk to your gate, okay? I just walked from B to E. It took me about 20 minutes. I didn't want to take the tram. I just wanted to walk, get some extra steps in. That way I could get some extra calories burned, all right? So these are ways to stay healthy during these holiday seasons and when you're traveling. Guys, just want you to be safe, be healthy, and be well. Happy holidays to all. Remember, if you're going to be traveling, wear your mask, all right? Wear your mask. If you're going to be around large crowds of people, make sure that you're not having any symptoms. Make sure that you are going to get tested for any type of viruses before and or afterwards. And most of all, stay healthy, be safe, and I'll talk to you after the holidays. Again, this is Dr. Nicole Edwards, board-certified family medicine physician, board-certified obesity medicine physician, integrative medicine physician, locums physician, and all of the things. Just coming to always keep you guys healthy, because I like to explain medical conditions in terms that everybody can understand. You guys have a wonderful holiday season. Stay safe, stay well. Dr. Nicole signing out. Bye-bye.